Hello, my name is James, and welcome to Test Taking Strategies for NCLEX-style questions, Part 3. First, we will revisit some concepts from Parts 1 and 2, then we will introduce new material. Let's think back to the positive and negative query questions. What is the question asking for? Is it asking for clarification of something positive or a lack of something such as understanding? When given a prioritization question, you'll have to think critically and apply Maslow's hierarchy of needs. Safety and physiological needs typically come first. Also, knowing how to triage patients based on needs and stability is important. Communication questions may also present. With communication questions, use multiple test-taking strategies and look for the most accurate of therapeutic responses. We will provide more detail on each of these throughout the presentation. This section is going to be over positive and negative event queries. Most questions are positive event queries. They are asking what is correct or accurate. Read the questions carefully and read every word. Words and phrases that indicate a positive event query include greatest, highest, select all that apply, understands, has been achieved, and adequately tolerating. How do positive query event questions look? A few examples are listed here. Which client has the greatest risk for developing complications? List in order the priority action the nurse would take. When will the nurse know the desired effect has been achieved? Most of these questions will involve using clinical reasoning skills and prior nursing knowledge. Here is another example of a positive event query. A faculty member provides instruction to the student about the technique of obtaining a two-step blood pressure reading. Which statement by the student indicates an understanding of the technique? The answer choices for this question were intentionally left out to focus on the question itself. Negative event queries are next. Here you are asked what is incorrect or inaccurate. Again, read the questions carefully. Identify key words and know what the question is asking for. What strategic words or phrases indicate a negative response is required? Negative examples include least likely, needs additional instruction, indicates a need for follow-up, has not met the outcomes, least priority, or ineffective. Sometimes it is necessary to reread the question to fully understand what is being asked. Here are some examples of a negative event query. Which client is least likely to develop complications? Which statement made by the nurse is least helpful for the patient? Which outcome indicates the goals have not been met? Now we took a previous question and changed a few terms. A faculty member provides instruction to the student about the technique of obtaining a two-step blood pressure reading. Which statement by the student indicates the need for follow-up? Now the question is a negative event query noted by the need for follow-up. Moving forward with prioritization questions. Read the questions carefully. Prioritization questions can be multiple choice. Some are ordered response. Some may have all correct options, but which one is the best choice or highest priority? Practicing these types of questions is imperative to build the clinical reasoning and understanding of rationales. Remember, the NCLEX is designed to see if you can provide competent and safe patient care. How to prioritize. Note the strategic word or phrase, check ABCs, use Maslow's hierarchy of needs, steps of the nursing process, and apply clinical judgment and cognitive skills. Maslow's hierarchy of needs starts with physiological needs and safety needs. There may be some questions where these two overlap. For example, if an unstable patient is short of breath, then this patient should be seen before the stable patient with the pain rated 9 out of 10. After safety needs come social needs, esteem needs, and self-actualization. Communication questions are next. Communication questions involve both verbal and nonverbal communication. You must consider the cultural and spiritual needs of the client, such as the Puerto Rican American discussed in Part 2. Communication can be between nurse and patient, or family, or other members of the healthcare team. There are some guidelines to communication questions. Ask who is the client in the question. Apply therapeutic communication techniques and avoid non-therapeutic responses. Avoid selecting answers with false reassurance or threatening statements. These are non-therapeutic or dishonest. Focus on the feelings, concerns, anxieties, or fears. Acknowledging the feelings and making a connecting statement might be the best response. Also, consider cultural or spiritual differences and the client's personal preferences. Communication question number 1. The client states to the nurse, "I don't understand why I have to take this medication when it makes me feel terrible." What is the nurse's most appropriate response? As we think about this, think about the event query, the question query, the subject, strategic words or phrases, and what are the client's feelings and concerns. Referring back to the question we just went over, there's a couple of responses. The first one would be, "You will need to ask your doctor." This avoids the question, so that is not a correct response. 2, "I hear that so often with this medication." This is not appropriate because it minimizes the client's feelings, so we'll eliminate that one. Number 3, "You don't want to have a heart attack, so you must take it." This one gives advice, false reassurance, and is threatening, so it is also eliminated. Which leaves us with 4. Describe what you mean by feeling terrible when you take this medication. This is the most appropriate response of the 4 choices. It restates what the patient has said, directs back to the client who can clarify. There are more test-taking strategies which we are about to discuss. Eliminate options with closed-ended words. Closed-ended words include all, always, cannot, every, must, never, none, not, only, and will not. If one of these words are in the option, then you can eliminate it as the answer most of the time. If the response by the client will be a yes or no, then it may also be incorrect. Open-ended questions are preferred in therapeutic communication because it opens the door for conversation and clarification. Question 2. The nurse is providing dietary instructions to a client about a low-fat diet. The nurse would make which statement to the client? 1. Never use butter for cooking. Never is one of those absolute words, so we are going to eliminate that option. 2. Drink fluids only if they are fat-free. That is also an absolute definitive word. Eat foods that only have less than 1% fat content only. Only is used once again, so we'll eliminate that. Which leaves us with 4. Read the labels on food items to determine the fat content. Not only is this the best choice, but this is the most therapeutic and helpful for the client. Open-ended words are usually a correct choice. Some examples of open-ended words are generally, may, possibly, usually, sometimes, and maybe. Question 3. A client asks a nurse when the results of their laboratory test will be available. What is the most appropriate response to the client? Is it 1, your doctor may have the results in about 3 days? Is it 2, the results will not be available for at least 1 week? 3, you must ask the doctor for that information? Or 4, every test is rechecked so it takes about 3 days? Now looking at the highlighted words, may is one of our open-ended words, so it's a possibility. Will not, must, and every are those closed-ended words, so they're not very helpful as far as being appropriate responses. So that eliminates 2, 3, and 4. Which leaves us with your doctor may have the results in about 3 days. Another test-taking strategy is to eliminate medical options and focus on nursing. The question is always asking for the action of the nurse. A medical option requires an order from the doctor. Over on the right are a couple of examples. Insert a Foley would need an order. Place the client in high Fowler's position is independent nursing action unless have an order to maintain supine position. Obtain a vial of furosemide in a syringe needs an order. Obtain a dose of morphine sulfate from the Pyxis system also needs an order. The next test-taking tip we'll discuss is eliminate comparable or alike options. The correct option will be the one that is different. If you don't know the answer, look for comparable or alike options. Here we have 4 choices. Weigh the client, check lung sounds for crackles, monitor temperature, monitor intake and output. The 3 that are highlighted are words related to complications of fluid overload, and checking the temperature is not. Another strategy is to look for all parts and to see if they are correct. When the options are 2-part, do both sides match? Are they both correct? Parts can be separated by the word and. All parts of the option must be correct for that answer to be correct. The example given here, what color paints will be mixed together to make the color orange? Is it yellow and blue? Is it blue and green? Is it yellow and red? Or blue and red? By knowing what mixture of colors makes orange, we know that the options eliminated would leave us with yellow and red mixed together would make the orange. Both sides of the and are correct, which makes 3 the best choice. What is the umbrella option? More than one option appears to be correct. The umbrella option incorporates or includes the other correct options, is a general statement that encompasses the other correct options. However, an umbrella term and other terms falling under the umbrella may all be incorrect, so read the question carefully. This concludes our 3 parts to test-taking strategies. Read your text, study, practice adaptive quiz questions, check your remediation worksheets, and practice the test-taking strategies. Good luck.